Even in the midst of economic downturn, one industry has maintained steady growth. Wellness centers across the nation are proving there is wealth in health.
Rochelle and her husband Ed understand the importance of being active and have made exercising a part of their daily lifestyle.
I like working out because it gets me going, and it's tough being a grandma.
Movement is medicine for them, creating change in their physical, emotional, and mental well-being.
I think everybody wants to feel good about themselves. You know, when you're working out, it releases endorphins into your body. Everybody feels better.
And unfortunately, fitness doesn't come in a bottle. The Centers for Disease Control and Prevention says more than 1/3 of U.S. adults are obese. Nationwide, the South has the highest prevalence of obesity at 29.5%, followed closely by the Midwest at 29%.
We had more of the family time aspect of life when in the 70s and even in part of the 80s, and then we've gone towards such a technology era that we're kind of missing a component, which is just time for yourself.
30 years ago, exercising consisted of maybe a treadmill and weights in a small room. Today, it's expanded to large facilities with hundreds of machines and personal trainers.
You've got space. You have access to personal trainers just about 24/7.
The focus of health is also important, though, for another age group. The CDC also says approximately 12.5 million children and adolescents aged 2 to 19 years old are obese. This has almost tripled since 1980.
It's not just about, you know, adults working out and becoming fit. It's about the children and making sure they're being active and not sedentary, and that's a problem that we're trying to solve.
This fitness center in Grand Forks, North Dakota has partnered with the USDA Human Nutrition and Research Center by providing space for wellness studies.
They will bring people into this facility, study their habits, you know, whether it be physical and nutrition, you know, a combination of both.
The opportunity to partner with other agencies, whether it's other healthcare providers, nutrition, and the like, is really where it's at. So it's so much more than just a place to go sweat.
And just like Ed and Rochelle, all we need is the right kind of motivation.
You need to move that body.
I'm Stephanie Scheurer reporting for Studio One.
Stephanie has more information on this story. With the help of Skype technology, she is at the University of North Dakota Wellness Center with Lori Bedding.
Thanks, Katie. Lori, when we talked in your interview before, we discussed a lot about exercising as being a part of wellness, but there's so much more to that. There's 7 dimensions of wellness, and could I have you just elaborate a little bit on that for me?
Certainly. We look at wellness as being intellectual, social, physical, environmental, spiritual. There's so many different parts to it, and especially on a college campus, we understand that it takes all of those working together to make a successful student. So we have things that we address as far as stress, spirituality. We do a lot with occupational, as you might imagine, but it is so much more than just physical.
Okay, and something else that stuck out in the interview to me was when you said wellness is a journey, not a destination. Can you explain that to me?
Certainly. When you put it in that perspective, it really opens you up to realize that it is a process, and sometimes it's forward movement and sometimes backwards. For example, someone who tries to quit smoking will often try 4 to 7 times before they're successful. So we want people to understand to just keep moving because we're all in it together.
Okay, thank you so much, Lori, for being with us again. Katie?
Thanks, Stephanie.